I want to talk to you today about something that people rarely connect to the heart, and that's easy to mistake for a throat problem or something to swallow past, yet that can be one of the ways the heart signals trouble. A feeling of pressure, tightness, fullness, or discomfort in the neck or throat. And when this can, especially with other signs, relate to the heart. Because we think of the neck and throat as the domain of swallowing, colds, or a lump in the throat, and rarely the heart. Yet the heart can refer discomfort to the neck and throat. So heart-related discomfort can be felt there, sometimes as tightness or pressure. So understanding when neck or throat discomfort might be the heart is genuinely important. So today I want to explain why the heart can cause neck and throat discomfort, how to recognize the concerning kind, especially the exertional pattern, the crucial emergency guidance, the common throat causes, and what to do, in partnership with your doctor and emergency services. And I'll be clear and balanced because while most neck and throat discomfort is not the heart, some can be angina or part of a heart attack, and recognizing it can save your life in partnership with these professionals. This is about recognizing an easily mistaken but sometimes important sign. Let me start with why the heart can cause neck and throat discomfort, because it grounds everything. As I've discussed about referred pain, the heart can cause discomfort felt in places other than the chest, including the neck and throat, because the nerves carrying discomfort from the heart share spinal levels with those from the neck, throat, and jaw. So the brain can interpret heart discomfort as coming from these areas. So heart problems, angina, or a heart attack can be felt as a tightness, pressure, or discomfort in the neck or throat, sometimes described as a constricting or squeezing feeling in the throat, or a fullness or pressure in the neck. This is why neck, throat, and jaw discomfort are recognized possible features of heart problems. So the heart can cause neck and throat discomfort through referred pain, felt as tightness, pressure, or a constricting feeling. A recognized possible feature of angina and heart attack. So understanding that the heart can refer discomfort to the neck and throat is the foundation. So the heart can cause neck and throat discomfort. So heart trouble can be felt in the neck or throat. Let me explain why the exertional pattern is such a useful clue, because it's the key insight. As with the jaw, tooth, and arm discomfort I've discussed, the exertional pattern is a genuinely useful clue with neck and throat discomfort. Angina, the heart discomfort of exertion, classically comes on when the heart works harder, walking, climbing stairs, exertion, sometimes after a large meal or in the cold, and eases within minutes of rest, recurring with exertion. So when neck or throat tightness or pressure follows this pattern, coming on reliably with exertion and easing with rest, that pattern points toward the heart, because ordinary throat problems don't behave that way, being related instead to swallowing, colds, the voice, or being present at rest. So neck or throat tightness that comes on with exertion, like walking, and eases with rest, especially with other heart symptoms, is a clue pointing toward the heart. So the exertional and rest pattern is a powerful clue that neck or throat discomfort might be the heart, since ordinary throat problems relate to swallowing or colds rather than exertion. So the exertional pattern is the key clue. So exertional neck or throat tightness eased by rest suggests the heart. Let me help you tell heart-related neck and throat discomfort from throat causes, because that's practical. While you can't reliably tell yourself, some features help suggest when neck or throat discomfort might be the heart. Discomfort more likely the heart. Comes on with exertion and eases with rest. The angina pattern is a tightness, pressure, constriction, or fullness, rather than a sore, scratchy, or swallowing-related throat symptom. May come with or spread from chest discomfort or to the jaw, arm, shoulder, or back. Comes with other heart symptoms, breathlessness, sweating, nausea, or lightheadedness, and isn't related to swallowing, a cold, or the voice. By contrast, discomfort, more likely a throat matter, is related to swallowing, a sore or scratchy throat, a cold or infection, the voice, or a persistent lump in the throat sensation, follows throat or neck problems, and isn't brought on by exertion and relieved by rest. So neck or throat tightness that comes on with exertion and eases with rest, or comes with other heart symptoms, suggests the heart, while discomfort related to swallowing, a cold, or the voice suggests a throat matter. So the exertional pattern and accompanying heart symptoms distinguish heart-related neck and throat discomfort. So read neck and throat discomfort by its pattern and company. So the pattern and company distinguish heart-related neck and throat discomfort. Let me give the crucial emergency guidance, because this is where it matters most. Here's the crucial, potentially life-saving guidance. Treat neck or throat discomfort as a possible heart attack and call emergency services immediately if you have a tightness, pressure, or constricting feeling in the neck or throat that is accompanied by chest discomfort or pressure, breathlessness, sweating, nausea, lightheadedness, or pain in the jaw, arm, shoulder, or back. Comes on at rest and is severe or unexplained, especially with these other symptoms, or makes you suspect your heart or feel very unwell. Neck or throat tightness can be part of a heart attack, sometimes when chest symptoms are subtle, especially in older adults and women. Don't dismiss neck or throat tightness with these features as a throat problem, or wait. And separately, neck or throat tightness that reliably comes on with exertion and eases with rest warrants, seeing your doctor promptly for possible angina. So treat neck or throat tightness with chest discomfort, breathlessness, sweating, or jaw or arm pain as a possible heart attack and call emergency services immediately, and see your doctor promptly for exertional neck or throat tightness that eases with rest. So act urgently on neck or throat tightness with heart symptoms. So neck or throat tightness with heart features is an emergency. Let me explain why this matters so much, because dismissal is dangerous. This matters because neck or throat discomfort that's actually the heart is genuinely at risk of being dismissed as a throat problem, a cold, or a lump in the throat, so someone could be having angina or a heart attack felt in the neck or throat and wrongly attribute it, delaying diagnosis or life-saving treatment. And as I've discussed, in a heart attack, time is muscle and lives, so delay is catastrophic. So recognizing that the heart can cause neck and throat discomfort, that the exertional pattern is a clue, and that such discomfort with heart attack features is an emergency can prevent this dangerous dismissal. So this matters because heart-related neck and throat discomfort is easily dismissed as a throat problem, risking delayed diagnosis or treatment, which recognizing the connection and the patterns prevents. So recognizing this connection prevents dangerous dismissal. So it matters because dismissal can be fatal. Let me keep balance because most neck and throat discomfort is not the heart. Let me be balanced. Most neck and throat discomfort is genuinely not the heart, coming from sore throats and infections, colds, swallowing or throat conditions, acid reflux, the voice, muscular neck problems, or the common benign lump in the throat sensation, and I don't want you to fear that every throat feeling is your heart. The vast majority of throat and neck discomfort relates to these throat and neck matters, to swallowing or to colds, not to exertion or the heart. The patterns that should make you think of the heart are the specific ones: neck or throat tightness coming on with exertion and easing with rest, or with other heart symptoms like chest discomfort, breathlessness, or sweating. So heed those specific patterns while treating ordinary throat and neck discomfort related to swallowing, colds, or the voice as the throat matters they usually are. So most neck and throat discomfort is a throat matter, while the specific exertional or symptom-accompanied patterns are the heart clues. So keep balance. Ordinary throat discomfort isn't the heart, but heed the specific patterns. So most throat discomfort isn't cardiac. Heed the specific patterns. Let me be clear about what to do because the response should match the discomfort. So here's what to do. For neck or throat tightness with heart attack features, chest discomfort, breathlessness, sweating, nausea, or pain in the jaw, arm, shoulder, or back, or severe unexplained tightness at rest with these features, call emergency services immediately as a possible heart attack. For neck or throat tightness that reliably comes on with exertion and eases with rest, see your doctor promptly as possible angina, treating new or worsening exertional discomfort as a possible emergency. For neck or throat discomfort clearly related to swallowing, a sore throat, a cold, the voice, reflux, or a persistent lump in the throat sensation without heart features, this is more likely a throat matter, treatable as such, though see your doctor if it's persistent, unexplained, or you're unsure, since persistent throat symptoms warrant checking for their own reasons. And if you're ever unsure whether neck or throat discomfort might be your heart, especially with the exertional pattern or heart symptoms, err on caution and seek help. So call emergency services for neck or throat tightness with heart attack features. See your doctor for exertional tightness that eases with rest. Treat clearly throat-related discomfort as such while checking persistent symptoms, and err on caution when unsure. So match your response to the discomfort, erring on caution. So respond per the discomfort's pattern cautiously. Let me paint you a quick picture of how this matters. Picture a man in his 70s who notices that whenever he walks uphill or hurries, he gets a tightness and pressure in his throat and neck, as if it's constricting, which eases when he stops and rests, and which he's been assuming is something to do with his throat. Understanding that neck or throat tightness coming on with exertion and easing with rest follows the angina pattern and can be the heart. He sees his doctor promptly, who recognizes the pattern, assesses him, and diagnoses angina, which is then managed and his cardiovascular risk addressed, preventing a possible heart attack. Had the tightness come on with breathlessness and sweating and not eased, he'd have called emergency services as a possible heart attack. The same man, but recognizing his exertional neck and throat tightness as a possible heart sign rather than a throat problem, got angina diagnosed and his heart protected. That contrast is exactly why understanding this easily mistaken sign matters. Let me speak briefly to those of you caring for an older parent or partner. Understand that the heart can cause a tightness, pressure, or fullness in the neck or throat, and that such discomfort coming on with exertion and easing with rest, the angina pattern, or with other heart symptoms, can be the heart, easily dismissed as a throat problem. You can help by recognizing that exertional neck or throat tightness that eases with rest is a heart clue, and encouraging a loved one to see their doctor promptly rather than just assuming it's their throat. Crucially, treat neck or throat tightness with chest discomfort, breathlessness, sweating, nausea, or pain in the jaw, arm, shoulder, or back as a possible heart attack and call emergency services immediately. For discomfort clearly related to swallowing, a cold, or the voice, it's more likely a throat matter, though persistent throat symptoms warrant checking. Helping a loved one recognize the heart patterns can get angina diagnosed or a heart attack treated, even saving their life. So let me draw this all together. A feeling of pressure, tightness, fullness, or constriction in the neck or throat, usually assumed to be a throat matter, can sometimes be the heart since the heart refers discomfort to the neck and throat. A powerful clue is the exertional pattern, neck or throat tightness that comes on reliably with exertion, like walking or climbing stairs, and eases with rest, follows the angina pattern and points toward the heart, since ordinary throat problems relate to swallowing, colds, or the voice rather than exertion. Neck or throat discomfort with other heart symptoms, chest discomfort, breathlessness, sweating, or jaw or arm pain also suggests the heart. Most neck and throat discomfort is genuinely a throat matter, but the specific exertional or symptom-accompanied patterns are the heart clues. So call emergency services for neck or throat tightness with heart attack features, see your doctor promptly for exertional tightness that eases with rest, treat clearly throat-related discomfort as such while checking persistent symptoms, and err on caution when unsure. So here's what I'll leave you with, straight and clear. First, understand that the heart can cause a tightness, pressure, fullness, or constricting feeling in the neck or throat through referred pain, a recognized possible feature of angina and heart attack. Second, know the key clue, neck or throat tightness that comes on reliably with exertion, like walking or climbing stairs, and eases within minutes of rest, follows the angina pattern and points toward the heart, since ordinary throat problems relate to swallowing, colds, or the voice rather than exertion. Third, recognize the features distinguishing heart-related neck and throat discomfort, the exertional and rest pattern, a tightness, pressure, or constriction rather than a sore or swallowing-related symptom, spread to or from the chest, jaw, arm, or shoulder, accompanying heart symptoms like breathlessness, sweating, or nausea, and no relation to swallowing, a cold, or the voice, while throat matters relate to swallowing, colds, the voice, or a lump in the throat sensation. Fourth, and crucially, treat neck or throat tightness with heart attack features, chest discomfort, breathlessness, sweating, nausea, or pain in the jaw, arm, shoulder, or back, or severe unexplained tightness at rest with these features, as a possible heart attack and call emergency services immediately, and see your doctor promptly for neck or throat tightness that reliably comes on with exertion and eases with rest as possible angina. And fifth, keep balance. Most neck and throat discomfort is genuinely a throat matter, related to swallowing, colds, or the voice, so heed specifically the exertional or symptom-accompanied patterns as the heart clues. Treat clearly throat-related discomfort as such while seeing your doctor for persistent throat symptoms, and err on the side of caution and seek help when unsure. The heart can signal trouble through neck and throat discomfort, and the exertional pattern is a powerful clue. So recognizing it and acting can get angina diagnosed or a heart attack treated, saving your life, which is genuinely important. So take care of yourself. Recognize exertional or symptom-accompanied neck and throat tightness as a possible heart sign, act urgently on heart attack features, and see your doctor for exertional tightness. And because heart-related neck and throat discomfort follows an exertional pattern or comes with other heart symptoms and is easily dismissed as a throat problem, please treat neck or throat tightness with chest discomfort, breathlessness, sweating, or jaw or arm pain as your reason to call emergency services immediately, and neck or throat tightness that reliably comes on with exertion and eases with rest as your reason to see your own physician promptly for possible angina.